The air in a therapist's office can be heavy with unspoken words, a silence that speaks volumes. Sometimes those words are about life and death, the most profound topics one can discuss. As mental health professionals, we carry the weight of understanding and responding to suicide risk, a task that demands both skill and empathy. It is a daunting responsibility, but a vital one, requiring us to be ever vigilant and deeply compassionate. Learning to assess suicide risk is not just about memorizing scales or procedures. It involves a deep understanding of human behavior and emotions. It is about connecting with another human being in their darkest hour, offering a lifeline when they feel most alone. It is about seeing their pain, hearing their story, and offering them a glimmer of hope, a reason to hold on. This is not a skill learned overnight. It is a lifelong journey of learning and growth. It requires ongoing training, supervision, and personal reflection, ensuring we are always prepared to help those in need. We must constantly sharpen our ability to recognize warning signs, ask difficult questions, and navigate complex ethical dilemmas with care and precision. The stakes are incredibly high, but the potential rewards are immeasurable, offering a chance to make a profound difference. To save a life is to touch not only that individual, but also the lives of their loved ones, creating ripples of positive impact. It is a privilege and a responsibility that we must approach with the utmost seriousness and compassion, knowing the profound impact we can have. Each session, each conversation, is a step towards understanding and healing, a chance to make a difference. The journey is challenging, but the rewards are beyond measure as we strive to bring light to the darkest moments.
Emily, a 21-year-old college student, walked into my office with a quiet despair that sent chills down my spine. Her demeanor was a stark contrast to the vibrant energy one would expect from someone her age. Her shoulders slumped, her gaze fixed on the floor. She seemed to carry the weight of the world on her small frame. It was as if every step she took was burdened by an invisible load. She seemed to carry the weight of the world on her small frame. Her eyes, once full of life, now reflected a profound sadness that was hard to ignore. She was studying literature, her once bright eyes now reflecting a profound sadness. The joy she once found in books seemed to have faded, replaced by a sense of overwhelming despair. A recent breakup, coupled with academic pressure and a history of childhood trauma, had plunged her into a deep depression. The combination of these factors created a perfect storm, leaving her feeling isolated and hopeless. Emily's story, though unique in its details, is not uncommon. Many young adults face similar struggles, often feeling like they are alone in their pain. Many students struggle silently with mental health challenges, their pain hidden behind forced smiles and academic pressures. The facade they maintain can be deceiving, masking the true extent of their suffering. Their pain hidden behind forced smiles and academic pressures. It's a silent epidemic that affects countless students, often going unnoticed until it's too late. Her case highlights the importance of recognizing the signs of distress in young adults. Early intervention can make a significant difference in their lives, providing the support they need to navigate their challenges. It reminds us that behind every face on campus, there are untold stories and hidden struggles. We must remain vigilant and compassionate, offering a helping hand to those who may be silently crying out for help. Emily's journey is a stark reminder of the fragility of mental health. Her story underscores the need for a supportive community, where students feel safe to express their struggles without fear of judgment. Creating an environment of understanding and empathy can make a world of difference. It's crucial that we foster open conversations about mental health, breaking the stigma that often surrounds it. By sharing stories like Emily's, we can encourage others to seek help and remind them that they are not alone. Together, we can build a community that supports and uplifts each other through the toughest times.
Emily's case is a testament to the power of early intervention and the impact of a compassionate support system. With the right help, even the darkest moments can lead to a path of healing and hope.
The initial session with Emily was about creating a safe space for her to share her pain. I focused on building rapport by listening attentively, without judgment, to her story. I used open-ended questions to encourage her to express her feelings and thoughts. "Tell me what brings you here today, Emily," I said softly, my gaze steady and reassuring.
She spoke haltingly at first, her voice barely a whisper. But gradually, as she began to trust the safety of the space, her words flowed more freely. Building trust is crucial in suicide risk assessment. It allows the individual to feel seen, heard, and understood. It creates a foundation for open and honest communication, which is essential for accurate assessment and effective intervention. This trust is not built overnight. It requires patience, consistency, and genuine care. As Emily began to feel more comfortable, she started to open up about her struggles, her fears, and her hopes. Each session became a step forward in her journey towards healing and understanding. The fragile bridge of trust we built was the foundation for her path to recovery. Section 4, Charting the Darkness, the Columbia Suicide Severity Rating Scale.
Assessing suicide risk is a complex process that requires a structured approach. It is not something that can be done haphazardly or without careful consideration. Each step in the assessment process is crucial for understanding the individual's mental state. One widely used tool is the Columbia Suicide Severity Rating Scale, or CSSRS. This tool has been adopted by many clinicians due to its comprehensive nature and ease of use.
The CSSRS helps clinicians assess the severity of suicidal ideation and behavior. It provides a structured way to evaluate the risk factors associated with suicide. It involves asking a series of questions about suicidal thoughts, plans, and attempts. These questions are designed to elicit detailed responses that can help in understanding the depth of the individual's distress.
Using the CSSRS, I gently asked Emily about any thoughts of suicide she might be having. This approach ensures that the client feels safe and understood while discussing such sensitive topics. Her responses revealed passive suicidal ideation, meaning she wished she wouldn't wake up, but had no concrete plans. This information is critical in determining the level of intervention required.
The CSSRS provides a framework for a comprehensive assessment. It allows clinicians to systematically evaluate the risk and make informed decisions. However, it is essential to remember that it is just one tool among many. No single tool can capture the full complexity of an individual's mental health. Clinical judgment, informed by the individual's unique history and presentation, is paramount in determining the level of risk and the appropriate course of action. The CSSRS is a valuable part of this process, but it must be used in conjunction with other assessment methods and clinical expertise. In Emily's case, the CSSRS was instrumental in identifying her passive suicidal ideation. This allowed us to tailor our intervention strategies to her specific needs, ensuring she received the appropriate level of care and support. The structured approach of the CSSRS, combined with clinical expertise, ensures that no aspect of the individual's mental health is overlooked. It is a critical tool in the ongoing effort to prevent suicide and provide comprehensive mental health care. Section 5, A Crossroads of Care, When and How to Intervene.
Based on Emily's CSSRS score, her history, and my clinical judgment, I determined that she was at moderate risk for suicide. This meant that hospitalization was not immediately necessary, but intensive outpatient treatment was crucial.
Deciding on the appropriate level of care is a delicate balance. It involves considering factors such as the severity of the risk, the individual's support system, and their willingness to engage in treatment.
In Emily's case, her strong support system, her desire to get better, and her lack of a concrete plan allowed for outpatient treatment. However, I made it clear that hospitalization would be necessary if her risk level increased. Regular follow-ups and continuous assessment were essential to ensure her safety and progress. Emily's commitment to her treatment plan and the support from her loved ones played a crucial role in her recovery journey.